Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is HIV destigmatization in Ghana, a focused strategic response to HIV prevention. Our guest is Dr. Elizabeth Armstrong-Mensah, who is a clinical associate professor with the Georgia State University School of Public Health, Department of Health Policy and Behavioral Sciences. Dr. Armstrong-Mensah has a doctoral and master's degree in international affairs and development, a bachelor's degree in sociology, and certificates in training and personnel development, and monitoring and evaluation. Dr. Armstrong-Mensah has held appointments as health scientist at the Centers for Disease Control and Prevention Center for Global Health, ORISE Evaluation Fellow at the Centers for Disease Control and Prevention National Center for Environmental Health, subject matter expert, assistant professor and global health track coordinator at the Morehouse School of Medicine, instructor at Emory University, national program officer at the United Nations World Food Program, and head of the Training and Human Resource Department at the Training, Research, and Networking for Development Group. Dr. Armstrong-Mensah has over 25 years experience in global health, HIV/AIDS, water and sanitation, gender issues, health equity and disparities, maternal and child health, program management and evaluation, capacity building, training, and instructional material design. She's the author of a British Medical Association nominated and highly recommended global health textbook published by Wiley & Sons, named Lecture Notes, Global Health Issues, Challenges, and Global Action, which was published in 2017, and 3 book chapters. She also has 40 publications in peer-reviewed journals. Her research interests include global health, HIV/AIDS, health disparities, mental health, maternal and child health, and infectious diseases. Today's webinar will be guided by 3 general questions. What are you doing? Why is it important? And how can we get involved? A quick note, if you have a question at any point during our conversation, please feel free to type into the Q&A box and we will try our best to answer. So let's begin. Dr. Armstrong-Mensah, welcome to the webinar. And if you would, please tell us about your research. What are you doing and why is it so important?
Okay, thank you very much. So greetings, everyone. And thanks, Brian, for having me and for giving me the opportunity to share my current research on HIV with the audience. My current research focus is HIV destigmatization as a strategy for HIV prevention, specifically in 2 administrative regions in Ghana. My interest in HIV began in 1999 when I was the National Program Officer with the United Nations World Food Program in Ghana. It was in that capacity that I first came to know and learn about HIV. And since then, I've been very interested in this area of research. Before I share my current research, I'd like to set the stage by first talking briefly about what HIV is, the global HIV prevalence and incidence rates, regions of the world most impacted by HIV, why a focus on Ghana, and what HIV-related stigma is. So the acronym HIV stands for Human Immunodeficiency Virus. It is the virus that causes AIDS or the acquired immune deficiency syndrome. Once in the human body, HIV weakens the immune system and makes it difficult for the body to fend off infections or diseases that it normally would have been able to prevent. A person living with HIV is said to have AIDS when their CD4 count is less than 200 cells per cubic millimeter of blood. HIV is a major global public health issue. Thus far, it has claimed the lives of about 40 million people worldwide. According to the World Health Organization, at the end of 2021, an estimated 38.4 million people were living with HIV, 650 had died from HIV-related causes, and 1.5 million people had acquired HIV globally. Now, from the map on the screen, it's very obvious that HIV is most prevalent in Africa, particularly in Eastern and Southern Africa. While not as high as in Southern Africa, HIV is also prevalent in West Africa, including Ghana, the focus of my research. So here's a little bit about Ghana. So Ghana is a country in West Africa located on the Gulf of Guinea. The country is bounded to the west by the Ivory Coast, to the east by Togo, and to the north by Burkina Faso. Ghana spans an area of 280,391 square kilometers and has a current population of about 31 million people living in 16 administrative regions and 216 districts. Overall, the HIV prevalence in Ghana is 1.6% with regional variation. According to the 2021 Ghana AIDS Commission regional HIV estimates, the Kumasi district in the Ashanti region and the Accra district in the Greater Accra region have the highest prevalence, hence the selection of these two regions for the study. The high HIV prevalence rates in these regions have been attributed to several factors, including low condom use, high numbers of female sex workers, infected people not beginning treatment due to the fear of being stigmatized, risky sexual behavior, increased commercial activity, concealment of HIV status among couples, and low socioeconomic status. So what is HIV-related stigma? Well, it is the prejudice, negative beliefs, feelings, and attitudes directed at people living with HIV/AIDS, their families, and even those who take care of them. HIV-related stigma is a multi-dimensional construct and manifests in various forms, including discrimination, shunning by family members, peers, and the wider community, as well as the erosion of rights, violence, and psychological damage. HIV-related stigma causes people to be labeled as socially unacceptable, and as a result, has negative implications for HIV testing uptake, care, treatment, and prevention. Perceptions of HIV as associated with certain groups of people and the belief that it is the result of punishment from God for immoral behavior such as prostitution, promiscuity, or drug use has caused negative judgments to be placed on all people living with HIV and AIDS. While some studies have been conducted on HIV-related stigma in Ghana, to the best of my knowledge and that of my team, and I believe some of them are either on right now or will be joining, none has been conducted to specifically identify strategies and content for multi-level interventions to destigmatize HIV and in the process help to eliminate the disease. In their 2021 study on HIV stigma and status disclosure in 3 municipalities in Ghana, Adam et al. Examined the relationship between HIV prevalence, HIV-related stigma, and people living with HIV. Using a cross-sectional study design, they found that fear of family rejection and shame were reasons for non-disclosure of HIV status. In their conclusion, the researchers stated a need for the implementation of culturally appropriate educational interventions to reduce HIV-related stigma at the community level. In their study on the lived experience of adolescents living with HIV in Ghana, Dodd et al. Found that fear of rejection, stigma, and public exposure were the main barriers to adolescent HIV disclosure. These researchers recommended the need for nurses to provide extensive public education on HIV and AIDS, its mode of transmission, treatment, and prevention, so as to improve the attitude of Ghanaians towards people living with HIV. In 2020, Jamra et al. Conducted a cross-sectional study of HIV-related stigma in 4 sub-districts in Kumasi. They noted that although much progress has been made in preventing new HIV infections and in delaying the progression of the disease since its emergence, very little has been done to halt the effect of stigma on men who sleep with men. According to these researchers, structured interventions with appropriate content need to be developed and implemented to prevent the consequences of HIV-related stigma as well as discrimination. Now, earlier this year, a team of researchers in Ghana and I published an article on global HIV progress in Sub-Saharan Africa, including Ghana. We tracked global HIV prevention progress, particularly in the areas of voluntary counseling and testing uptake, access to antiretroviral therapy, and HIV-related stigma 40 years after the emergence of the disease. We found that while global success has been chalked in two of the aforementioned areas, HIV-related stigma has and continues to impede greater success. So as a way forward, we suggested a few things at 4 levels. At the individual level, people living with HIV need to be educated on how to protect themselves and their human rights in the face of stigma. At the community level, social and structural interventions to change beliefs about people living with HIV need to be implemented. At the national level, governments need to create safe spaces for people to talk publicly about HIV, as doing this will help to normalize the subject and correct any misconceptions about the disease. And at the health system level, healthcare provider phobias about HIV must be addressed, as the fear of acquiring the disease causes some to take unnecessary and often destigmatizing actions like double gloving and, trying to put patients in a room aside from others, but thinking that would be a level to focus on as well. So it is in the bid to close the gap and to contribute to the science on HIV prevention through Hiv Destigmatization that the study was designed. My team and I believe that understanding HIV-related stigma from the perspective of people living with HIV, medical practitioners, adolescents, and community members can help inform the development of strategic, culturally appropriate, and effective interventions to reduce and eventually eliminate the stigma associated with HIV. Thus, our study seeks to focus on factors that influence HIV-related stigma among people living with HIV, medical practitioners, adolescents, and community members, the challenges HIV-related stigma poses for HIV prevention, care, and treatment, and recommendations for specific strategies and content to include in the development of culturally sensitive interventions for people living with HIV, medical practitioners, adolescents, and community members to destigmatize and prevent HIV in Ghana. So generally, we chose to focus on these 4 populations because doing this will address the issue under investigation at different but connected levels simultaneously. Specifically, we chose to focus on these populations because people living with HIV experience numerous challenges associated with stigma, which influences their engagement in care, well-being, and disease transmission. Medical practitioners are important stakeholders in their communities, and their attitude towards people living with HIV and AIDS have significant implications for the successful implementation of HIV prevention programs. Adolescents account for 5% of people living with HIV and about 11% of new HIV infections globally, yet they are underrepresented in HIV stigma reduction interventions. According to the United Nations Children's Fund, if the tide of HIV is to be turned around by 2030, then concerted efforts must be made to target adolescents. And because with the right intervention, community members can help to reduce and eventually eliminate HIV-related stigma in Ghana. We have 3 research questions that align with the study purpose. The research will utilize a mixed methods cross-sectional design. Study participants are people living with HIV above the age of 18 years. We'll also focus on medical practitioners, adolescents that are people between the ages of 10 and 19 years, and community members living in the Ashanti and Greater Accra administrative regions of Ghana. A total of 2,100 people will be surveyed. The principal investigators and co-investigators will manage the study. Field supervisors will provide oversight of data collection in each of the regions. Employees of the Ghana AIDS Commission and the Santreso Government Hospital will help with data collection in the regions. 2 biostatisticians will provide data analysis and statistical support for the study. 4 different survey questionnaires focusing on various domains have been developed to collect data from each of the target populations. All questionnaires have been reviewed by collaborators at the Ghana AIDS Commission in Accra and the Santresa Government Hospital in Kumasi. Following the receipt of IRB approval from the Ghana Health Service, the data collection instruments will be tested with a pilot population in the Ashanti and Greater Accra regions that will not be included in the main study. Study participants will give their consent to participate in the study by signing an assent or consent form. Data collection will begin in this month.
Well, yeah, thank you for sharing that, Dr. Armstrong-Mensah. And I'm curious, for those of us listening on here, what can we do as a community to be able to help you in your research and become advocates for your work?
And I think to get to that point, maybe we talk about why destigmatization is important, right? And then I'll move into that.
Please.
Yes. Thank you very much, Brian. That's a very, very great question. So let's begin by looking at why HIV destigmatization is important at all. Now, HIV destigmatization is necessary for the treatment or for the attainment of the new joint United Nations program on HIV and AIDS proposed global 95-95-95 targets to be achieved by the year 2030. The improvement of the quality of life of people living with HIV, upholding the human rights to healthcare, and for the maximization of investments in HIV prevention, care, and treatment programs. Now, the World Health Organization's Global Health Sector Strategies on HIV for the period 2022 to 2023 recommends shared and disease-specific country actions to guide the implementation of strategically focused responses to end HIV by 2030, as stated in the Sustainable Development Goals. According to the World Health Organization, the identified strategies must focus on reaching the people most affected by HIV and at risk, and must address inequities. And this is where HIV destigmatization comes in as an important strategy for HIV prevention in Ghana. And now to the other question that you asked, Brian, how can anyone help? And my response would be individuals, particularly those in Ghana, can help by volunteering to participate in the survey, spread the word on the need to, destigmatize HIV, and be willing to participate in interventions once they have been developed. Okay. And this concludes what I have to say. And Brian, I don't know why I keep calling you Ryan, but Brian, I'm turning it over to you.
Yes. Well, again, thank you. And that's very helpful for those of us who are listening here. And again, I want to let everybody know that's on the webinar. Please feel free to send in some questions and we will get to those. I have my first question, just to follow up with what you presented. In your opinion, and you touched on this a little bit, but what are the cultural and societal factors causing the stigmas you've mentioned in your research?
That's a very good question. So I would say it's the fear of the disease, right? People in Ghana know HIV, but I'm not sure that everybody is conversant with how the disease is transmitted. So there's some misconceptions there. And then there's also the shame and disgrace associated with the disease, and the association of HIV with certain behaviors and certain population groups that are not, looked on favorably in Ghana. So I would say those are some of the cultural and societal factors causing the stigma that I'm trying to get rid of among the Ghanaian population, if that's possible. Yeah.
And is there, and again, you've talked about this a little bit, but I wonder if you can go in more detail. Is there an infrastructure in place in Ghana to deliver antiretroviral medicines or PrEP to those living with HIV/AIDS?
Yes, there is infrastructure within the health system, both public and private. Most of these hospitals have HIV clinics that people who've been diagnosed with HIV visit. They have appointments, and so they go for consultations, and then there's a time when they go to get their medications. And I must say that in Ghana, antiretroviral medications are free of charge, and currently delivery is universal thanks to the WHO's 2016 Treat All policy, which recommends antiretroviral therapy for all people diagnosed with HIV, regardless of their CD4 count. And when it comes to pre-exposure prophylaxis, I've been told that it's available on a pilot basis in 3 administrative regions in Ghana. That would be the Greater Accra region, the Ashanti region, as well as the Western region.
Mhm.
And it's only available to special populations, and these would be female sex workers, men who sleep with men, as well as people in serodiscordant relationships. I've been told that Ghana did not accept a nationwide delivery due to issues related to sustainability, and because at this moment, those medications, PrEP, are provided to the Ghanaian government or to the Ghanaian population through the US President's Emergency Plan for AIDS Relief through the USAID. So it's there, but not everybody has access to PrEP. But with antiretroviral therapy, it's available to all.
Gotcha. And then I feel like messaging and as we've learned through the pandemic is very important. So I don't know if there are there any creative messaging options being implemented by the Canadian government to help with your work? And by that, I mean, for example, could let's say an economic message asking the population to help those with HIV/AIDS for the good of the workforce. Could something like that work or along those lines?
Oh, yes. I mean, and the government of Ghana has been active actually on this front. I mean, there have been creative messages asking people to destigmatize HIV and asking people to be tolerant of people who have it and let them stay in the workforce. I know that these messages have not been as visible as they were in the past, but they're there. And I know that there are billboards that have messages on HIV and the fact that, we need to begin to be a bit more sensitive to people who have it. Yes.
Gotcha. And in the chat, we have a question. Could we say that destigmatization will pave the way for prevention, treatment, and care to become most effective? And then as a follow-up, we provide a safe space through efforts in destigmatization?
Yes, I mean, the whole thing, the main reason why is that most people who are living with HIV or those at high risk for HIV don't seek care or don't disclose. It's because of this whole issue of stigma. Nobody wants to walk to a clinic and, oh, where did they go? Oh, they went to that space. Oh, that's the space dedicated for people who have HIV, right? So once we are able to deal with destigmatization and once we are able to talk about HIV as we talk about headaches or diarrhea or maybe cardiovascular conditions, people will be more free to disclose their status to people and therefore not transmit it without people's knowledge. People would adhere to medication, to their medication regimens, will take it. People will not be afraid to disclose HIV. And so, yes, I believe strongly that if we are able to destigmatize HIV, we would be well on our way to, preventing future transmission and future infections.
And to your knowledge, are there any other countries that you've noticed doing this correctly, or are you kind of flying solo and figuring it out on your own? Or are there any models that you've been able to maybe utilize?
I haven't found any literature in a country that's doing what we are proposing to do. What I know is that in some places there have been efforts to try to engage the medical community. Like, how do we get them to stop destigmatizing their population? I mean, like the people who come to see them, so the thing is, what language are they using? How are they treating these patients? Are they refusing treatment? Are they referring them unnecessarily? Are they just making them feel bad for having the condition? That's what I've seen. I've read from the literature conversations around we need to do these things, but I haven't really seen, if you will, meat and potatoes content saying this is how we do it. Yeah.
Gotcha. Well, that's the questions I have, and I want to follow up then with if there's any more in the chat, please feel free to. You've got a little bit of time extra, but if not, my final question for you is, where do you see your research in Ghana in the next 3 to 5 years?
Well, I'm hoping that once we conduct the research and we get the results, we'll be able to use the results to inform a grant, an NIH grant, to actually go to Ghana and implement pilot interventions in these two administrative regions that I mentioned. And if we are successful, I believe that we'll be able to roll it out, because I have, as one of my principal investigators, the Director General of the Ghana AIDS Commission. And I also have the person who is responsible for HIV, at the Centresa Government Hospital in Kumasi. So I can see that if we do get good results, it shouldn't be a difficult thing to start rolling out some of these programs or initiatives or interventions, I should say, to get people more aware of HIV and to say that it's okay to let people talk about it. Let's destigmatize it, because there's more to gain from destigmatizing than from not allowing these people to feel free to let us know what their status is, or for them to seek care.
Gotcha. We have one more question just came in,
Okay.
and it's this individual would like to know if there are any interventions in Ghana to help PLW HIV in response to HIV stigma in individual levels.
I'm not sure if they are doing it at individual levels, but what I know is that, I mean, like I said a few minutes ago, I know that they do have conversations around, let's destigmatize HIV. There are billboards around letting people know that this is not the way to go. But I'm not sure how successful the government has been with regards to individual efforts. And I know that I have some of my colleagues from Ghana on the call. So if any of you are on and you're willing to add, please go ahead and do so. But I think that is the end result we're trying to achieve, where individuals are aware and individuals are comfortable to talk about it. That couples don't even hide it from each other, right? Because I did find out that sometimes couples don't tell each other that they have HIV, and that's an individual level. So it means there's still discomfort and there's still some kind of sensitivity to disclosing status. So I'm sure that maybe hopefully with this effort, we'll be able to get to that point where people feel at ease to talk about HIV freely.
Gotcha. And there was a comment that there hasn't been any individual level.
Mm-hmm.
And then since we're running short on time, I have one final question from
Yes.
the group. It says patients who go specifically to an HIV clinic may feel stigmatized. Do you think if those patients use the same patient stream for any disease to go for comprehensive care would help to destigmatize?
That's a great question. I thought about that yesterday. I was reading about how medical practitioners, they call it flagging of the chart, right? So it's kind of like they flag the chart and then they kind of like separate people who have HIV from those who don't have HIV. I am not a medical doctor, so I'm not quite sure, but I know that there's something to be said about in the beginning when we didn't know about how the disease was transmitted. We didn't know too much about it. So we thought, let's separate. But if you want to separate, do it in a way that doesn't destigmatize the patient. It's not like, hey, that's the chart for Mr. A, put it on the side. Anywhere that has a red, put it on the side. And everybody around is kind of like looking and say, why are they putting it on that side, right? And when they put one and one together, it's like, oh, it might be because they have HIV. So if you want to separate them, okay, but do it in a way that is respectful of those living with the condition, because it's not an easy disease to live with, especially in the climate that we are in right now in certain parts of the world where we can't talk freely about the disease. Yes.
Gotcha. Well, we'll have to leave it there. We're short on time. I appreciate all the questions and everyone filling those out and sending them in. But I will say that I want to thank everyone for attending the Currents of Public Health webinar today. And I want to thank particularly Dr. Armstrong-Mensah for participating in this informative conversation. And this is very important work. And thank you very much for sharing all that you're doing. And we wish you well as you continue to do this very valuable work. In closing, the School of Public Health at Georgia State University is one of the most comprehensive and diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnerships with communities, their residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Armstrong-Mensah, and thank you all for attending. Please join us for the John R. Lutzker Lecture Series. That is coming up very soon, and it's hosted by the School of Public Health. It will be on September 12th at 2 p.m. For more information about this series, please visit publichealth.gsu.edu and click the About tab at the top of the page, and you'll find out more information about the Lutzker Lecture Series. Thank you all for attending, and be well, and we look forward to seeing you next time. Take care.